Alright, so today's video on my channel is going to be a lot different than anything I've posted before. This video is actually a project for one of my classes in university. It's for my Contemporary First Nations class, and I'm going to be telling the story of 7 young girls who unfortunately committed suicide in one First Nation in Canada. So this story takes place in the Wapakeka First Nation. I hope I'm saying that right. I'm sorry if I'm not. On January 8th, 12-year-old Jolynn Winter died by suicide, and 2 days later, her best friend Chantel Fox also hanged herself, and 3 months later, their good friend Amy Owen also died by suicide. So that's 3 girls within a close radius who are all best friends who committed suicide. And in total in 2017, 7 young girls around the same age, 12, 13, died by suicide in the area of Wapakeka. The reason why this story is so important is not just because it's so tragic, but it's because it highlights a much greater issue in Canada right now. So mental health for Indigenous youth all over Canada is way different than it is for the rest of Canada. So overall, Indigenous people in Canada, just in general, have higher rates of depression, alcoholism, violence, and suicide, with the most impacted people being children, unfortunately. In 2001, the average life expectancy of non-Indigenous people was 77 years old, whereas for Indigenous people, it was only 70 years old, so that's a 7-year difference. So overall, they have higher rates of mortality than the rest of Canada, and are more likely to have deadly health problems than non-Indigenous people. The potential years of life lost before the age of 75 due to accidents or major health problems are 50% higher in areas that have more Aboriginal people. And 40% of these injuries or health problems are due to suicide. In Northern Ontario specifically, in the Anishinaabe Aski Nation, which is a Treaty 9 territory, the number of suicides since 1986 is 566. And of those, 219 were young people between the ages of 15 to 20, and 88 were children between the ages of 10 to 14. Which means that out of the 566 people in that area who have committed suicide, about 300 of those have been children, 20 years or younger. Today, the First Nations community inside Treaty 9, which includes Wapakeka, have one of the highest rates of youth suicides in the entire Western world. So that's a staggering amount of people. When you take into account how high the populations are in Canada and the United States, it's insane that in just this one little area, we have the highest rates of youth suicide. The suicide rate among young Indigenous women in Saskatchewan between the ages of 10 and 19 is 29.7 times higher than that of non-Indigenous women in the same age range. Also, the suicide rate among First Nations men in the same age group is 6.4 times higher than that of non-First Nations men. So the difference between non-Indigenous and Indigenous people committing suicide is crazy. Indigenous people make up less of the population, but they have the higher rates of suicide, which I think that kind of shows the problem in itself, is that there aren't as many people, but there's higher amounts of suicide, which is, it's staggering. It really just doesn't make any sense. Well, it does. I'll get there. Okay. Over the past several years, nearly half a dozen young men in the area of Seabird have died by suicide just by going to the railroad tracks. And on April 10th, 2016, 7 children between the ages of 9 and 14 from the Northern Ontario community of Attawapiskat First Nation were admitted to the community's 15-bed hospital for possible drug overdoses in an attempted suicide. There were 11 suspected suicide attempts within a 24-hour period. And throughout history, in these First Nation areas, there's kind of been spikes in the amount of suicides. It kind of all happens at once or it doesn't happen at all. That's kind of the trend that happens. So 2 of Canada's foremost researchers on youth suicide, Michael Chandler and Christopher Lalonde, point out that among British Columbia's 200 First Nations communities, it is estimated that Indigenous youth take their own lives at a rate between 5 and 20 times higher than those of non-Indigenous youth. So again, we see the disparities between Indigenous and non-Indigenous groups. It's a trend that continues to happen. Just by reading these statistics, if you're just hearing of this for the first time, it probably seems insane. You're probably wondering, like, how did this happen? Where did this come from? Why is it just that these communities are so affected by mental health in these ways? And unfortunately, there isn't just one answer that can explain everything. It's a long history of oppression and of the Canadian government trying to get rid of Indigenous people. And now we see the effects of that tragic history affecting the youth in these communities in ways that the rest of Canada just doesn't experience. So if we really want to understand where this problem came from and how it's gotten to this point, we have to go all the way back to the beginning. We have to go back to when European colonizers first arrived in North America in the 16th century. These colonizers disrupted Indigenous groups all over North America by trying to save them from being savages. And they did this by sending missionaries out to different areas with Indigenous people and tried to convert them to their religion and their way of life. And as their institutions began to grow in this region, they tried whatever ways they could to disrupt the Indigenous population's lives by breaking apart families and using violence against them. And the biggest thing to happen during this time was when the Europeans came over to North America, they brought all kinds of diseases with them. Indigenous people hadn't been exposed to these diseases yet. This outbreak alone led to 90% of the Indigenous population being completely killed off. So, since Canada has become its own country in 1867, the federal government has implemented many different policies that have continued to oppress and just attempt to get rid of Indigenous people as a whole. In 1867, the Canadian government passed the Indian Act, which was created and intended to assimilate all First Nations groups into Canadian society. They wanted to get rid of the Indian problem, and that's kind of where things started to take a really, really bad turn. So this act made it so that First Nations could not practice their cultural beliefs and could not have any form of governance. First Nations were forced to live on reserves in areas that the government picked out for them, and they were kind of isolated from the rest of Canadian society. And unfortunately, this act also brought residential schools into law, and if you haven't heard of residential schools, I just want to give a warning here that this is a heavy topic to be discussed, so feel free to click away if you don't want to hear about this. So residential schools are one of the darkest parts of Canadian history and have played a huge role in why there's so many mental health problems for Indigenous youth in present day. The Canadian government added a policy in the Indian Act which made it so that First Nations children had to attend a school that was enforced by the Catholic Church, which taught them how to be Canadian. Their hair was cut off, their clothes were changed, they changed their names, they forced them to speak English instead of their native language. And the first school opened in 1880, and the last school didn't close until 1996, which that was only 2 years before I was born, so that's not that long ago whatsoever. Overall, 150,000 children were forced into these schools during this time, and not only were they forced to give up their culture and identity, they faced horrendous living conditions where they endured physical abuse, sexual abuse, and psychological abuse, like I kind of pointed out before. They also experienced a lot of malnutrition, and the education they were receiving wasn't even proper education. I read a study somewhere that said that when most of these children graduated from the school, they only graduated with about an 8th grade level of education. So and they were in their late teens usually when they graduated, so they really weren't benefiting from this in any aspect whatsoever. And the shirt that I'm actually wearing right now is one that I got from visiting a residential school in Brantford, Ontario. I'll put some of my own photos, probably right here, to show it. So while I was there, I got to see the school itself. I couldn't actually go into the school because there had been water damage and they were repairing everything. But even just being there and seeing the museum and hearing stories about what took place there, it makes me sick to my stomach. So in my experience with talking about residential schools, I've just kind of noticed that Canadians kind of like to push it out of the way and kind of don't like to talk about it or admit that this even happened in the first place. So while we were there, we did a virtual tour of the old school itself, and during the virtual tour there was one thing that really stuck out to me, which was when the woman who was guiding the tour was kind of going through all the rooms and talking about what went on there. You felt sick to your stomach, obviously, because you're like, these were just children going through this abuse. And there was one specific moment that stuck out to me where she opened up the door to the boiler room and was kind of like, this is the boiler room, like this is where all the like boiler room stuff is. And then she said that this is where the priests used to take the children to sexually assault them. And the fact that that's a known fact about that room, and that that room specifically was for that, so that people couldn't hear what was going on, I don't know, that just really stuck out to me. It really, like, it hit me right here. You know what I mean? It's so awful. Survivors of the school, when they got out, they often led kind of like a more dark life, if that makes sense. A lot of survivors went to addiction and had severe mental health issues after getting out because of the abuse they endured. And this abuse and trauma they went through has actually led to intergenerational trauma, which means that every generation that is born continues to experience trauma from their relatives, and it continues on since there really isn't much of a change from government. So like survivors of residential schools, when they had kids, they kind of passed that trauma and that addiction, that mental health issues onto their children, and then their children pass that on to their children. And so it's kind of just this continued cycle. So First Nations Regional Health Survey showed that exposure to a previous family generation that went through residential school is associated with an increased risk for lifetime suicide. And having 2 generations of residential school history within your family increases the odds of reporting a suicide attempt compared to having just 1 generation. So that's kind of what's proving my point here, is that it keeps going through the families and it doesn't really just end after the school's closed. Another thing as well is that when these survivors left the school, you know, the government didn't really take into account what had happened to them. They were kind of like, okay, they're out of the school, they're fine now, but there wasn't really much mental health or just healthcare in general available for these survivors. There wasn't the proper resources available to the survivors to help treat their mental health issues and to help make sure that they can reintegrate back into society without any issues. So not only are they trying to overcome their trauma, they also are behind the rest of Canadians because they didn't get the proper education they needed, and they don't have access to mental health facilities. And it's just an overwhelming cycle of abuse and of just not treating Indigenous people the way that the rest of Canada is being treated. Why is all of this relevant to the current issue taking place? Well, understanding the historical background is essential in understanding the current mental health crisis going on. The government forced Indigenous populations onto reserve to try and isolate them from the rest of Canada, and they tried to assimilate their cultures and make them a part of Canadian society, and like I said before, wanted to get rid of the Indian problem in Canada. They put residential schools in place, which led to the abuse of over 150,000 Indigenous children. Forcing these children to be separated from their culture caused them to be separated from their ancestry and their connection to their traditions and spiritual beliefs. And since there has not been proper resources allocated to help survivors, the trauma just keeps being passed down through generations, like I said before. So all of this buildup has led to where we are now, which is that the government has kind of forced the Indigenous populations off to the side and not provided them with the proper resources needed to treat their trauma. So now all the families and all the children being born into this generational trauma and all of this mental health, all these mental health issues throughout their ancestry are just screwed, basically. I don't want to make it sound like there's no hope, that there's no light at the end of the tunnel, because there is, and things are being done now, thankfully. So the Canadian government is actually beginning to acknowledge that and take ownership for the genocide and the oppression they have caused for hundreds of years for Indigenous populations, which is a big step because before they would not recognize what happened. They refused to take part in, or they refused to take ownership in what had happened. And there are many Indigenous people and Indigenous groups working towards fighting the crisis and helping these youths get the help that they need and help get through this rough time. So an elder named Maggie Pettis, she lost her brother Cliff to suicide 5 years ago, and then she lost her nephew Brian as well. And she spent decades trying to improve healthcare and education in Seabird. She's now working on a suicide prevention study, which is focused on returning to cultural teachings to strengthen Indigenous pride in each Seabird child. So she is working very hard to make sure that each child is treated properly and given the help that they need so that they don't grow up to just commit suicide one day. Nathan Obed also is a person who is trying to help the crisis. He was a hockey player and a coach in Nunavut, and he said so himself that he has lost count of how many children or parents of children have died by suicide in his community. He's been a driving force behind the creation of the National Inuit Suicide Prevention Strategy, which was released in 2016. And it's currently the only suicide prevention strategy in Canada that is coordinated on the national, regional, and community levels. So this is a really important program that is helping people right directly at the source where they need it. And part of this program is identifying common risk factors and creating a shared evidence-based Inuit-specific approach to suicide prevention. And on the website for this program, they specifically outline that suicide prevention is best undertaken by community members, friends, and family who understand the social context of the community that they live in. So some of these strategies include community-based approaches, which is like coming together to help one another, gatekeeper training, school-based suicide prevention programs, so like teachers and educators know what to do and can notice when a child is in need of help. Another key aspect in helping Indigenous populations is using spirituality. So in Western approaches to mental health, the Indigenous concept of well-being and spiritual wellness is largely absent, but for a lot of cultures for Indigenous people in Canada, spirituality is such an important factor, and having an approach that takes that into account instead of just the Western world's idea of suicide prevention can be life or death, you know? So going back to my original story of the Wapakeka First Nation, Anna Betty, I'm going to insert her name here because I can't pronounce it, and I apologize for that. She is the Deputy Grand Chief of the Anishinaabe Aski Nation, which is a political organization of 49 Northern First Nations encompassing an area roughly the size of France in Northern Ontario. She says that kids don't talk about suicide for no reason and talk about a pact. They're talking to each other about their trauma. This is children suffering together. So she's basically saying that children commit suicide together and they form pacts because that's how they deal with grief. That's all they know. So she says that I can't believe people are ignorant to that fact. She has worked tirelessly to help bring mental health care, help, and suicide prevention awareness to the epidemic gripping her nations. She wants to address the nation's complex and often underlying issue of past and present abuse and its deadly fallout. So this is kind of going back to the history that I was talking about earlier, including residential schools. She's been urging the communities to open up and embrace a multifaceted plan aimed at recognition, healing, and justice. So in 2018, Wapakeka's Band Council passed a resolution, which is the first step in a plan to address historical abuse in the community, which is a really important step for being able to treat trauma and mental health. The one thing that I hope that you can take out of this is that there is light at the end of a very, very, very long tunnel, and that there is hope. Like I said, communities are coming together, and the Canadian government is finally recognizing that things need to be done in order to help these children who are suffering in our country. So I hope you were able to learn some new things today. I hope that I was able to explain the situation to the best of my ability. There's a lot of things I know I didn't include, but there's so many different aspects to this issue that it's hard to kind of narrow it down. So I hope I did a good enough job in explaining all of that, and I hope you are able to learn some new things and just be aware of what's going on. I think that's the first step for all of Canada and all Canadians, and to just be aware and to keep your eyes open and to pay attention to what's going on and talk about it. So feel free to share this video, and feel free to not share. It's okay. Thank you so much for listening, and yeah, I'm gonna go now. Bye.